Welcome to the second lecture of week 2 in the VBP educational program. This is the outline of today's session. Introduction to I-STAR, elicit negative values, that is I's, and elicit positive values, star values. Now we will look at what is denoted by I-STAR. So I stands for ideas, C stands for concerns, and E stands for expectations. So these above three things are considered as negative values, and so the next important thing is how will you elicit the values of a patient, especially I-STAR. So communication skills plays a major role in eliciting values of patients. It's a skill that should be developed from our day-to-day practice when we are consulting patients. In some consultations, patients will reveal their ideas, concerns, and expectations when they start to discuss about their problems. But in some clinical consultations, some of the patients will not reveal their ideas, concerns, and expectations related to their health issues. In that kind of scenarios, these questions can be directly asked from the patient to reveal them. These questions are examples to elicit the negative values of your patients. So for elicit ideas, how do you think you develop this condition? Do you think this condition that should be treated? And for concerns, what concerns do you have about living with this condition? What concerns do you have about the potential treatments? And regarding the expectations, what are your expectations from me as your healthcare provider? And what are your expectations from entering the healthcare facility? As clinicians, we tend to find out problems that the patients are facing. Eliciting positive values is also important, which can be helpful to produce a more appropriate management plan for the patient. These are some of the examples of how to elicit positive values of patients. So for strengths, what skills do you possess that you are proud of? What has enabled you to reach to this point in your life and or care? For aspirations, what or whom do you hope to become? What do you plan to accomplish in the next 10 years? For resources, do you have family members or friends who could help you with your care? Are you connected to any spiritual, religious, cultural, or other communities? Communication in values-based practice is bidirectional or multidirectional process, including important aspects of listening, body language, and word choice. We must consider both the kind of questions we ask as well as the way that we ask them. Good communication skills are essential to values-based practice, and the relevant skills include individual perspective skills and multi-perspective skills. What are individual perspective skills? Skills like listening and empathy aimed at understanding the values of individuals, patients, families, and professions involved in a given decision. Multi-perspective skills are skills like negotiation and conflict resolution concerned with resolving conflicts between different value perspectives. Listening is also a key component of communication, and these are the common barriers to listening. Making hasty judgments about the merits of what a person is going to say and inappropriately filtering information or not managing internal or external distractions, and communicating with labels rather than to people. For example, alcoholic is kind of a common label that we use, and rehearsing your own answers while the other person is talking. So these are the common barriers you have when you are listening to a patient. Now we will try to find out how to elicit patients' values by listening to this scenario.
This is a story involving 16 years old Anne, her mother and their long-standing GP, Dr. Pereira. Anne had been diagnosed with type 1 diabetes at the age of 3. Her mother is a single parent who stopped work when Anne was diagnosed to take care of her. Anne usually had a good glycemic control with very few admissions to hospital. However, with adolescence, things had become a bit more complicated. Anne's control had become more erratic, with a rise in HbA1c in recent months. She had a recent emergency admission following a severe hypoglycemic attack linked to a drinking binge. She was not willing to talk to other doctors and doesn't want to go to pediatric clinic. Instead, she agreed to meet Dr. Pereira.
Hello, and what made you visit me today?
Dr. Pereira, I'm so glad we could get to see you. You'll have heard what happened at the weekend. I'm so worried. She could have died, you know, and she doesn't seem to care. She doesn't think about what this is like for me. She keeps trying to pretend that she can just ignore her diabetes and it will go away. Can't you talk some sense into her? I'm at my wit's end. We're arguing all the time.
So, and what's been going on? What's wrong?
The doctor has identified that there is a conflict between the mother and the daughter. So to diffuse this situation, the doctor has decided to take them separately as it will provide some space for them to express themselves individually without hesitation. Having listened to the conversation, we will try to elicit negative values of mother regarding the ideas she thinks her daughter doesn't care about the disease. Regarding her concerns, she is concerned about the daughter's life and health. Regarding the expectations, she wants the doctor to advise the daughter regarding the importance of proper management of the disease.
Okay, and now please tell me what's been going on. You've always done so well with your diabetes. Come on, you can tell me. What's the problem? What's wrong?
Communication skills is one of the most important skills in eliciting values of patients. Here, asking open-ended questions is one of the important ways to initiate the talk in patients rather than yes-no questions. Patients will open up their values when you ask them open-ended questions. And try to acknowledge the good points also encourage people to open up.
I just feel that I've had enough of diabetes ruling my life. I can't get away from it, or from you. I can't forget it just for one day. I just want to be normal, for a change. I'm sick of people treating me differently.
Okay.
How do you think it feels that everyone saw me dragged off in an ambulance after a night out?
Yes, Anne. I can understand.
I know you always harp on about problems later in life, but that's not what bothers me at the moment. I'm not going to have another hypo in public. It's so humiliating.
In this kind of situations, it is important to let the patient talk about her feelings. Showing empathy and active listening while letting the patient talk is very important skill this doctor is presenting.
My friends thought I was bonkers when I didn't know where I was, and my boyfriend thought I was dying when I passed out. It's all too much. Having the HbA1c you want me to mean being half a stone heavier and being totally miserable through hypos and testing every 2 minutes. No thank you.
Yes, there's obviously a lot going on for you at the moment, and we'll get a chance to go through everything in more detail later on. Shall we start by thinking about that hypo?
As I mentioned, reflective listening and showing empathy towards patients' feelings is an important skill to develop. Sometimes when you allow the patient to talk, they will try to talk about a lot of things and to release their tension. In that instances, if there is a more than one issue to talk about, you need to focus 1 or 2 topics you need to discuss first. Now we will try to identify the negative values of the daughter. Regarding ideas, she thinks that diabetes is ruling her life. And regarding the concerns, she is worried about the humiliation caused by the disease when she became unconscious among her friends. And also she is worried that she is being treated as a deceased person. And regarding expectations, she wants to lead a normal life as the other teenagers of her age. Let's look at the management guidelines of type 1 diabetes before we move forward to look at the management given by the doctor. American Diabetic Association guidelines will give you the evidence-based guidelines which help you to come to a management plan. So it has basically 3 aspects we will look at, that is pharmacological management, nutrition and physical activity. So first thing is pharmacological management. So the recommended are type 1 diabetic patients are mostly treated with multiple daily injections of prandial and basal insulin or continuous subcutaneous insulin infusions, and use rapid acting insulin analogs to reduce hypoglycemic risk, and training patients to match prandial insulin doses, carbohydrate intake, pre-meal blood glucose and anticipated physical activity. Now let us look at the nutrition therapy. Recommendations are individualized medical nutrition therapy is recommended for children and adolescents, and monitoring carbohydrate intake is key to achieving optimal glycemic control. And comprehensive nutrition education and diagnosis with annual updates by an experienced registered dietitian nutritionist is recommended. Then the physical activity and exercise. Recommendations are moderate to vigorous intensity aerobic activity for 60 minutes daily, and education patient and family about prevention and management of hypoglycemic attack during or after exercise and overnight after exercise is important.
Dr. Pereira asks Anne how much she knows about alcohol-induced hypoglycemic attack. As he suspects, she proves to be well aware that she should prime herself with carbohydrates and then top up before going to bed. But this is where Anne's concern about her weight has got in the way. Anne has been studying for her advanced level exams and working mainly from home. She thinks she has had relatively little exercise for some months. Dr. Pereira explains that regular exercise will help with blood sugar control and at the same time allow her to eat properly without gaining onto weight.
How about doing some exercises?
I love swimming and my boyfriend too.
Anne likes this idea. She had been a good swimmer as a child and says she had been thinking of taking this up again.
It is very important to check the patient's understanding of the disease condition or management rather than always advising them about what should be done. It is important to find out the options that match the individual patient's preferences, like the doctor found out the suitable exercise for these patients. Though we advise the patients to do exercises like walking or running, they might not be interested in doing that, especially when it comes to chronic diseases. So it is important to find out the patient's preferences, which can be sustainable as they will enjoy them.
What about your mom?
What about her?
Well, moms don't always like boyfriends.
Oh, no, she's fine about my friends. It's just the diabetes. She's on about it all the time.
Well, she's worried about you. You know, any mom would be. Why don't I have a chat with your mom on her own for a few minutes, and then we can agree a plan together.
And after discussing everything, the doctor skillfully asked about her mother and tried to talk to the mother individually, which is an important approach of conflict resolution.
I have to admit to being very worried when I heard what happened to Anne last weekend. I spent long enough working in emergency department to hate seeing what binge drinking does to young people.
But it's not that, doctor. She's never been much of a drinker. That's why I can't understand what's happened. Things have got more difficult recently, but I put it down to her exams. She wants to be a forensic scientist. You know, but she needs to get really good results, and she's been studying too hard. I thought I was doing the right thing encouraging her to go out more, and then this happens, and she might have died if it hadn't been for her boyfriend realizing what was happening.
As physicians, we tend to find problems or negative values in patients as we need to fix them. But it is important to elicit the positive values as it will help us in the management. Physicians should utilize the positive values for patient management. So these are the positive values of Anne according to the conversation. Her strengths are she works hard and well focused on studies, and she has good social skills. For example, having built up a good group of friends and found a boyfriend in whom she had felt able to confide. And aspirations, she plans to become a forensic scientist, is both realistic and well-directed goal. And resources, her boyfriend who is good at dealing with an acute situations like hypoglycemic attacks. So these are the positive values of Anne.
What about you? Do you have any plans now?
Oh, me? Well, I was planning to get back into nursing.
How does Anne feel about that?
Anne's fine about it. She has been really encouraging to me, in fact. But obviously I'll have to put all that on hold.
Sounds good to me. Let's get Anne back and then.
After discussing about all the problems, asking about herself is also important, which will diffuse the situation for a while, and then the doctor talked about the issue with the three of them.
We need to think how best to help you manage things during your exams. It's bound to be a difficult time, and I do feel a bit out of my depth when it comes to working out how to best juggle your insulin around your lifestyle. But there are people, like Nurse Laura at the hospital, who you know, and Nurse Tracy here, who we can work with. Nancy would be happy to see you in the adult clinic if you would like me to send her a letter.
Thank you.
And Nurse Tracy is starting a group for young people with diabetes if you would be interested in talking to her.
Let me think about that one.
In this scenario, as this patient is a teenage, it is important to give her some time and provide some options to come up to sort out her problem. In this conversation, the doctor has elicited both negative and positive values of the patient, like categorizing ideas, concerns, and expectations of mother and daughter, and categorize the strengths, aspirations, and resources of mother and daughter regarding the situation. And he was able to sort out the conflict between the mother and the daughter and came to a management plan. So this is the end of session 2, and I think this will be an example for you to how to apply the values-based practice in your clinical encounters. And please do the group work in the Google Classroom using this as an example. So please continue with that, and thank you for listening to me.